Section 2 of creating a contractor ergonomics program to reduce soft tissue injuries among construction workers discusses the causes of soft tissue injuries and related risks. The complete program is available on the Best Built Plans Contractor Training Program page at www.bestbuiltplans.org. This contractor program is part of the Best Built Plans program, which includes resources to help you plan and train for safe materials handling at each phase of your project to reduce the risk for soft tissue injuries. So how do soft tissue injuries, which include sprain, strain, and overexertion injuries, and are also known as musculoskeletal disorders or MSDs, develop? These injuries occur when different soft tissues of your body, your muscles, nerves, bones, and connective tissues like tendons and ligaments, are damaged. The injuries develop gradually over time because the tissues are damaged daily by heavy workloads. This damage accumulates in the tissues, eventually causing the damaged tissues to fail. The injury may seem to be a sudden event, such as an incident of low back pain. The task or activity that caused the injury may be the same activity that caused tissue damage in the past, but not always. This is important to consider if you use past injury records to figure out how to change the way the work is done. The damaged tissue often becomes chronic or persistent, which means it lasts for a long time and possibly the rest of a worker's life. In the low back, the damage occurs to the joint and discs. The soft disc is a cushion between each bone, shown as green in the lower center photo. When the body bends forward, the disc or jelly center pushes backwards and may bulge, applying pressure to the spinal nerves, causing pain. The back is complex. Once the tissues develop wear and tear, it is very hard to get them to heal. The bottom right photo shows a worker with knee bursitis who spent a lot of time kneeling on a hard floor without the benefit of padding against the floor. This worker's doctor recommended a knee joint replacement. Once you have this procedure, it is difficult to kneel. So this worker could not go back to doing the same type of work, at least the way he used to work, by kneeling. Ergonomics is a science to reduce the risk of soft tissue injuries. Since heavy physical demands will cause excess wear and tear on a worker's body, the goal of ergonomics is to fit the job tasks, tools, and environment to meet the physical abilities of the worker. There are several ergonomic hazards that should be considered in each work task because they can make the work too demanding for a worker's body. These hazards are high force, awkward postures, repetitive motions, stress from contact against the body, hand or body vibration, and working in a cold environment. Force is the amount of physical power needed to move an object. It is the most important hazard that causes physical stress or wear and tear on the body. In construction, this often occurs from handling materials. But how much is too much force? It's easy to decide whether something is too heavy for one person if it weighs a lot, such as 200 pounds or more. It's more challenging to decide if one person should lift an object that weighs, say, 100 pounds, or if they should lift an object that weighs 80 pounds but must be carried a long distance, such as to the other side of a building or job site. The National Institute for Occupational Safety and Health, or NIOSH, recommends lifting no more than 50 pounds by one person, which is why airlines charge more if a bag weighs more than 50 pounds. Defining how much is too much for your employees to lift will be helpful for controlling hazards from lifting. How does the weight of the load affect your low back? The weight can be measured through spinal forces at the joints of the low back. In this colorful diagram, the figure to the far left is standing upright with no load. The spinal forces from gravity on the low back is 80 inch-pounds. The second figure is holding a 20-pound load close to the body, or 10 inches from the hands to the low back. This is an ideal posture to carry a load. The spinal forces go up to 170 inch-pounds. If the load is moved away from the body to a distance of 20 inches, the spinal forces increase significantly to 260 inch-pounds as shown in the third figure. This shows that how close you hold an object in front of your body makes a big difference to your low back forces. The fourth figure shows the large increase in spinal forces from lifting an object from the floor. The distance to the box is larger and the body is not upright. The spinal forces have more than tripled from the ideal figure, changing from 170 inch-pounds to 635 inch-pounds. To reduce physical stress, it's important to keep the load close to the body, consider the vertical location of the materials whenever possible, position them at waist height, and limit the weight of what one person can lift and carry without help. Equipment or teams should be used to lift and move materials weighing 50 pounds or more. Your insurance company may have resources available to help you determine the risk for tasks your workers perform. For example, Liberty Mutual has an app that can help gauge the risk and recommend movement modification to prevent injuries. Awkward posture is another common hazard in construction work. The far left picture on the screen, which shows a person working at floor level using a forward bent posture, is an awkward posture that causes increased spinal force. The second photo from the left shows a person kneeling, which causes a contact stress between the hard ground surface and the knee. The other two photos show individuals working overhead and above the shoulder level. Doing overhead work places the body in another poor or awkward posture. Working in this posture decreases a worker's available strength to perform the task and will cause fatigue more quickly. Anytime a worker's hand is positioned above their head height, there is high stress on their shoulders, increasing the risk of having a shoulder injury. Other hazards that contribute to risk for soft tissue injuries but may not involve handling materials are highly repetitive tasks, such as repeatedly tightening objects using a wrench, contact stress, hand and body vibration, such as that used by jackhammering, and working in a cold environment. This ends Section 2, which answered the question, what causes soft tissue injuries? Section 3 discusses what should be included in a company's ergonomics program to prevent these injuries. And Sections 4, 5, and 6 provide more details on what to include, how to develop your program, examples of solutions for some common hazards, and where to find more examples of solutions.